Hey, good morning. Happy Tuesday. It's time for Tidbit Tuesdays. So, this week, what I thought I would do is talk a little bit about myself, my background, my history, and how that helps me help people. So, I was in the medical industry for about 25 years, have a business degree in management, so I managed medical and dental practices for that time. So, I've seen a lot of insurances from the perspective of the doctor side because I was very involved with billing. So I understand dental billing is so much easier than medical billing. There's a lot less involved with that. But I've done dental billing, I've done medical billing. So I understand enough about how that works, how it's important to bill things correctly, and how it's important to stay on top of the insurance companies as far as getting approvals and making sure they pay it correctly, making sure the doctor bills it correctly. There's a whole bunch of things involved in that to make sure that that happens correctly. So also with insurance, having been a manager, I admined the benefits for those said practices. So I was very familiar in helping small business owners, because they were all small practices, less than 50 employees, help decide what benefits to offer employees, deal with brokers and insurance companies from that perspective as an employer, putting benefits in place, helping to attract and retain employees, all that kind of thing. Then I actually had a family member that was seriously injured back in 2000. And there was tons and tons of claims in dealing with disability and dealing with Social Security disability and getting claims paid, all those things that involved in that. So I have a unique perspective in helping clients from a client standpoint in getting those things done. So how does all of that help you? So how that helps you is I have knowledge that most brokers do not have. Most brokers have not had to do medical billing. A lot of them don't even understand it. Other insurance agents not necessarily have dealt with admitting the benefits as an employer, and many of them have not maybe had to even deal with claims for themselves or family members. So I take all of that knowledge that I've learned, all my experiences, and I use that to help my clients. So I help my clients in picking the right plan. If you've ever had a consultation with me, you know that I give you 30 minutes. I ask all the questions, all the personal questions. What are your meds? What's your height and weight? Do you use tobacco? How do you use your health benefits? All that helps in determining what benefits you should have. And that's really important because you can go online if you wanted a marketplace plan and just buy something you think sounds great. But if the benefits aren't there on how you're going to use them, you're going to think it's a terrible plan. Well, it could be a terrible plan, but the odds are it's because you didn't pick a plan that was matching to how you were planning on using your insurance. You picked it based on deductible or copays, which is not always the smartest way to do it, or cost. Not always the smart way to do it. Sometimes you could pay a little bit more in premium and get a whole lot more benefits because of your situation. So that's super important. So that's how I operate. I hate insurance companies too, because I think that they don't do right by the client. They certainly don't pay the brokers very well. So they collect all this money and I get a very teeny tiny small fraction of that premium that they collect, which is really shocking to most people when they find out, how do you get paid? I said, well, the insurance companies pay me. All the companies pay about the same, so it doesn't matter to me which company you go with. It's just that I get a very small portion, whether your premium is $2,000 a month or $300 a month, I get the same amount, which seems crazy, but it's about $22 a month. It's really not that much. So anyway, so I use all that information to help pick a plan that's right. I know which insurance companies tend to be easier to deal with, depends on the situation. And then again on the back end. So what happens when you get a big bill? So this is where I can also give you some advice. Now, I do not do this for people personally because one, I don't have the time, and two, I would have to charge you so much to do this, it would negate all the savings you would get. So I certainly want you to save money. I'm not trying to charge you a whole bunch of money to use my consultation services. So what I do is if you're my client, you send me the bills, I can review them. One, we always need to make sure that insurance paid based on the codes. We also need to make sure it was billed correctly. Sometimes that can be a challenge. But once we determine those things, then that will help decide what our next move is. Do you truly owe $5,000? Is the bill accurate? Okay, well, let's say it is. Let's say you do owe, it looks like you do owe $5,000. Then we play the next game. So we play the waiting game to get that collection letter, because when you get the collection letter is when you can negotiate with the collection people. Crazy as that sounds, you can almost automatically get a 50% discount if you wait till you get that first collection letter. And people freak out because oh my gosh, my credit. Well, surprise, your credit is not affected. In fact, they can't even report you to the credit bureau for 12 months. 12 months. So you have a lot of time to negotiate with them. So depending on the size of the bill, yes, you can ask for financial assistance. I skipped that step. You can ask for financial assistance, but let's say you don't qualify for financial assistance. Then yes, we play the collection waiting game. And it's so important. People are just blown away. You know, I'm of a generation, we're told to pay our bills. You know, you pay the bills on time, but hospitals, ERs, imaging, labs, they all overcharge. Not fair pricing. Their excuses, they're not going to get paid that much by insurance. But knowing what certain things cost, I will tell you they are way overcharging for most things. So why would you want to pay those ridiculous prices? Well, they're going to keep billing it as long as people keep paying it. So the way around that is for us to stop paying it, because we can't depend on anyone else to take up our cause. It's going to be on you to take care of yourself. And this is how I help people take care of themselves. Not pay a big bill. So again, back to the $5,000. Now it's 91 days old. You get a collection letter, you call. If you feel $2,500 is a fair amount, say, hey, what can you do? You know, I feel like I was overcharged. Usually they come back and go, I'm authorized to give you 50%. Great. Can I set up a payment plan for that? Or if you have cash in hand or credit card in hand, as it were, give them your credit card and you're done. Doesn't affect your credit. Nothing happens. Now you can play this game each month. I have not tested this, but I do know that the longer you wait, the more you're probably going to get a discount. So if the bill is really large, maybe wait till you get the second collection letter and call and see if they're offering anything better than 50% off. Why not? You know, again, it comes down to what you're comfortable with, but I will tell you, once you realize that they're messing with you, it should make you mad, and it should make you kind of enjoy this game a little bit. It certainly does me. So you can keep playing this game. And then something good to know is there's a lot of places, because of all the laws that are coming into effect to help consumers, that there's a lot of places that don't even report to the credit bureau. Shh. Right. That means you can never pay the bill and nothing's going to happen. Because they can't deny you services if you have an emergency. Now, true, now if we're talking doctor's offices, yes, they can dismiss you as a patient. Hospitals, ERs, if you have an order or if you have an emergency, they have to treat you. Again, that's a law. So, all my expertise, I bring to the table. You get so much with me that you may not get with other brokers, and that's how I set myself apart. I truly try to be an advocate for you, whether it's toward the insurance company or toward provider, just to ensure that you do not overpay for something you don't need to overpay for. So we'll talk more about that later. Until next week, peace out.